Hi, this is Dr. Steve Vargo, and this is episode 5 of Can I Ask You One Question, where we tap into the minds of experts in a particular area, people with unique insights, and try to learn one thing from them that we can apply to our personal or even our professional lives. And I have here with me Dr. Eric Botts, and Dr. Botts is a practice owner with locations in Illinois and Iowa. He's a past president of the Illinois Optometric Association, and he's also CEO of OBC Billing Specialists. So how's it going, Eric?
Good, it's going great.
So Eric, as an eye doc vendor, I lean on you and your team a lot to answer questions, billing questions that come up from our members. So that's exactly what I'm going to do now, is ask you another question. So my question to you is, what ocular disease has the biggest potential ROI and income growth for an optometric practice?
Well, Steve, I think I love the question, and I think for me it's an easy one to answer. I have lectured on so many different ocular diseases over the last 15 years or so. And the return on investment is something that I can easily measure in my head as to what it costs to treat and what's the return on investment. And so it just so happens that what I think is probably the biggest return on investment as far as an ocular disease for the most optometric practices, I think, is probably dry eye or ocular surface disease. It's also becoming a huge passion of mine over the last few years because of the technology. The technology has improved so much with dry eye over the last 4 or 5 years. It's really made diagnosing and treating dry eye so much easier, and it's taken a lot of the guesswork out of it. And it also, for me, has probably showed me the best care that I can give my patients, and with the biggest return on investment as far as providing great care for the patients. Not just a financial, but I just love the fact that patients are appreciating the care that I'm giving them, and that it's making a difference. And the reason why I think dry eye has such a huge financial return on investment is, number one, I see about 300 dry eye patients a year, and I do no marketing for it whatsoever. These are all patients that I would ordinarily have seen anyway. And prior to bringing in the technology like Inflammidry and Tear Lab and Mybography into my practice, honestly, I was probably just neglecting a fair amount of these patients, giving them artificial tears, and telling them I'd see them in a year. And once I decided that there's got to be a better way to do this, and I invested in the Tear Lab, the Inflammidry, the Mybography, and I started having these patients come back especially with the Tear Lab. You actually have a number to give them. And so they were actually interested in, well, how am I doing? And so what I really found with the ability to do the laboratory tests is that now all of a sudden patients are buying into the treatment plan, because it's kind of like the patient who's having their blood pressure checked by their medical doctor. They know what a good number is, they know what a bad number is, and they know, okay, well, I've reduced the salt in my diet, I've taken my pills, it's working. Same thing goes with dry eye now. They're using the omega-3s, they're using their artificial tears, I'm putting in punctal plugs, and all of a sudden their osmolarity numbers are coming down. The inflammation's going away. They feel better. Their eyes, they see better. And so the return on investment from a financial standpoint, though, it has really brought this to my attention, because the tests that I do, the Tear Labs, and the Inflammidry and the external photos are all billable procedures that I can do for the patient. But every time I see these patients, I'm going to bill out an office visit as well. And so when you start adding this up, it starts adding up quite quickly as to the number of office visits you're doing, a 99213, or in the past 92012. Then you throw in the punctal occlusions. I do typically been doing anywhere from 600 to 700 punctal occlusions a year. Those numbers are all adding up very rapidly, and the return on investment that I'm seeing now, the last year, just dry eye patient only is I probably am grossing a little over $200,000 in fees associated with tear lab, office visits, inflammatory, punctal plugs. You can throw in some amniotic membrane insertions there as well. It all adds up. And frosting on top of the cake is the fact that patients actually appreciate the care. They notice a difference.
You used the word neglect before, and I had a rep tell me once that he estimated about 95% of ODs are really neglecting to fully invest into the service. And that's pretty significant, but it also creates a lot of opportunities for those ODs like yourself that are, in terms of the word of mouth and people going out. I imagine a lot of people would eventually present to an OD or a clinic that specializes in the service, having been to other doctors that didn't solve their problem. Have you experienced that over time as you've made this a more impactful part of your practice, more people coming to you for this specific service?
Absolutely. I'm getting referrals from patients, from patients who have really liked the treatment and liked the improvement that I've been able to offer them. One of the things that I think has really stepped it up a notch for me is just implementing a dry eye protocol in my office, to where if a patient comes in is complaining of dry eye issues or blurry vision or anything that we might think is a dry eye problem, immediately they're put into our protocol. So we are immediately testing them. And when I see the patient, I've already got results from their tear lab, their inflammatory, their external photos, and it really has expedited the process quite a bit. I think it's much more beneficial to have that protocol put in place with your staff, so that you're working together with your staff members who are doing your pre-testing, and they're able to ask the right questions. And when the patient responds the way that meets the criteria in your protocol, you're now able to start the process of diagnosing their dry eye issues, and it just has really taken off from there.
Yeah, when you get into multiple $100,000s for an additional service, that's pretty significant. So, well, thanks, Eric. How can people find out more about your billing company, OBC?
You can find us at claimdoctor.net, or you can Google optometric billing consultants. But claimdoctor.net will take you to our website, or you can email me at drvision@claimdoctor.net.
Great. Well, thanks, Eric. You guys have been a great vendor, and thanks for sharing with us.
Absolutely. Thank you, Steve. Have a great day.